Tonight, the CDC says the infected passenger passed through busy SeaTac Airport in Seattle, the first confirmed U.S. case of the contagious coronavirus now in Washington state. With emergency measures being taken to stop the spread in China, the death toll from coronavirus has doubled to 6 as the number of confirmed cases soars to some 300.
The last memory I have of my final day in high school, before I was swept up in the flurry of remote learning, was of me and my friends sprawled out across the floor of the lunchroom, planning our outfits for senior twin day. Looking back, I think what struck me most about that day was just how perfectly ordinary it appeared to be. I didn't expect March 13th to be the final day when I would be able to ride the subway to my school, grab an iced coffee from the local deli, and greet my friends with a hug in person. And so, when I turned the television on to be greeted by the news that in-person classes were indeed canceled, I went numb with shock. It felt absolutely surreal to process the news that my senior year had ended on such an abrupt notice.
More than 250,000 lives lost to the coronavirus, and at a sign of the worsening emergency across this country, New York City tonight, the original epicenter, suddenly making the call to close public schools, turning to remote learning for now. Governors across the country imposing new restrictions tonight. We are now averaging 160,000 new cases a day in this country.
Still, as I spent my time locked up in my apartment, I couldn't help but feel conflicted. On one hand, I felt grief for the experiences I had lost, the friends who I never got to say goodbye to, the teachers who I never got to properly thank, and the graduation ceremony that got reduced to a 3-hour video. Yet on the other hand, I also couldn't help but feel remorse. My parents had told me of the devastating impact that COVID had in Myanmar, my birth country. I learned about how the pandemic further exacerbated pre-existing issues, as shown by the children who were unable to continue their education due to their lack of access to the internet, the increased rates of bankruptcies among small businesses, and the mounting pressures rising cases had on their already fragile healthcare infrastructure. It made me feel guilt for mourning for what seemed like an increasingly trivial matter. Beyond this, I had also experienced conflict in my own personal life. My parents had been employed as sushi chefs at the Fashion Institute of Technology, a state university in New York. As a consequence of the pandemic and the resulting shutdown of colleges, their business had slowed down considerably. At first, I felt joy. I was used to my parents working long hours for their shifts, and so seeing them at home more often was comforting to me. But there was also an underlying tension that my parents had felt, of how they were supposed to gather enough money to both support our family and pay our bills.
We've had nearly 9 months of the pandemic to get this right, and still, many healthcare workers do not have the personal protective equipment that they need.
During the summer, I was a scribe at a local clinic. I've been working there for the past few summers, so it was jarring to see all of the changes in protocol due to COVID. Now, when we saw patients, we were completely suited up. We wore gowns, N95s, face shields, and hand sanitized or washed our hands every few minutes. Especially near the beginning of the pandemic, when supplies were running low, I saw a lot of people in the office feared that we'd run out of PPE. What would happen then? Would we have to shut down? Would we still see patients? It was a gastroenterology clinic, and a lot of the patients were elderly. Many postponed their procedures in hopes that the virus would essentially settle down.
We are planning to invite back to our campus all of our graduate students and all of our undergraduate students who are willing to make a commitment to the public health principles and practices that we need to observe in order to operate this campus safely.